I've treated thousands of seniors over my 30-year career in vascular medicine, and there's one complaint I hear almost every single day. Doctor, my feet are always cold at night. Most people dismiss it as just part of getting older. They pile on extra blankets, wear thick socks to bed, or crank up the heat. But here's what terrifies me: cold feet aren't just uncomfortable. They're often your body's first warning sign of poor circulation, and if ignored, they can lead to serious, even life-threatening complications. Let me be absolutely clear. Cold feet in seniors are not normal. They're not harmless. And they're definitely not something you should just live with. When your feet are consistently cold, especially at night, it means blood isn't flowing properly to your extremities. And if blood isn't reaching your feet, where else isn't it reaching? Your heart? Your brain? Your kidneys? The brutal truth is this: poor circulation doesn't just make your feet uncomfortable, it increases your risk of blood clots, stroke, heart attack, nerve damage, and even amputation. Every single night you ignore those cold feet, you're missing a critical signal your body is desperately sending you. But here's the good news. Once you understand what's really happening inside your body, there are simple, science-backed strategies you can use right now to improve circulation, warm your feet naturally, and protect yourself from the serious complications that poor blood flow can cause. In this comprehensive guide, I'll walk you through everything you need to know about the hidden link between cold feet and poor circulation in seniors, including the warning signs most people miss, the underlying causes doctors don't always explain, and the practical solutions that actually work. Most seniors have no idea their cold feet are connected to their heart health, their diabetes risk, or their vascular system. But after today, you will. All medical references and scientific studies I mention are based on current vascular medicine research and clinical practice guidelines. Before we dive in, here's a question I want you to think about. How often do your feet feel cold? Is it just at night or throughout the day too? Drop your answer in the comments below. I personally read and reply to every single one because your experience matters, and your story could help someone else recognize the warning signs. Now, let's start with the foundation, understanding exactly what's happening in your body when your feet won't warm up, no matter what you do. I've treated thousands of seniors over my 30-year career in vascular medicine, and there's one complaint I hear almost every single day. Doctor, my feet are always cold at night. Most people dismiss it as just part of getting older. They pile on extra blankets, wear thick socks to bed, or crank up the heat. But here's what terrifies me: cold feet aren't just uncomfortable. They're often your body's first warning sign of poor circulation, and if ignored, they can lead to serious, even life-threatening complications. Understanding the hidden connection, why your cold feet are more than just cold. When you complain about cold feet to your doctor, most of the time you'll hear something like, "It's just poor circulation," or "That's normal at your age." But what does poor circulation actually mean? And why does it happen in the first place? Here's what's really going on inside your body. Your circulatory system is like a highway network. Your heart is the engine, pumping blood through arteries, the main roads, to every part of your body, including your feet. Once blood delivers oxygen and nutrients, it travels back through veins, the return roads, to your heart and lungs to get reoxygenated. This cycle happens continuously, every second of every day. But as we age, this highway system starts to break down. Arteries become narrower due to plaque buildup, a condition called atherosclerosis. Blood vessels lose their elasticity and become stiffer. The tiny capillaries in your feet, which are already the farthest point from your heart, receive less and less blood flow. Add gravity into the equation. Blood has to fight against gravity to return from your feet to your heart, and you have a perfect storm for poor circulation. When blood flow to your feet decreases, several things happen. Your feet don't receive enough oxygen and nutrients, causing that persistent cold sensation. Waste products and toxins accumulate because blood isn't efficiently carrying them away. Nerve endings become damaged from lack of oxygen, leading to numbness, tingling, or burning sensations. Your body prioritizes vital organs like your heart and brain, essentially sacrificing your extremities to keep you alive. According to research published in the Journal of Vascular Surgery, peripheral artery disease, PAD, a condition where narrowed arteries reduce blood flow to the limbs, affects approximately 8 to 12 million Americans, with seniors over 60 accounting for the vast majority of cases. Yet studies show that up to 50% of people with PAD have no symptoms, or they dismiss symptoms like cold feet as just aging. This is dangerous for two reasons. First, if your feet aren't getting adequate blood flow, neither are other critical parts of your body. Pad in the legs is often a sign that you have blockages in arteries supplying your heart or brain, dramatically increasing your risk of heart attack and stroke. Second, poor circulation in your feet can lead to serious complications like non-healing wounds, infections, gangrene, and in severe cases, amputation. According to the American Heart Association, people with PAD are 6 times more likely to die from heart disease than those without it. A 67-year-old retired postal worker from Illinois came to my clinic complaining about cold feet that kept him awake at night. He'd been dealing with it for 2 years, but never mentioned it to his doctor because he thought it was just old age. During our examination, we discovered severe blockages in the arteries of both legs. He was months away from developing gangrene. Early intervention, medication, lifestyle changes, and a minor procedure saved his legs and quite possibly his life. Cold feet are not just a comfort issue. They're a medical warning sign. And understanding this connection is the first step toward protecting your health. But what exactly causes this circulation problem in seniors? That's what we need to explore next. The 7 hidden causes of poor circulation that lead to cold feet in seniors. Now that you understand the basic mechanism, let's dive deeper into the specific conditions and lifestyle factors that cause poor circulation in seniors. These are the hidden culprits most people, and unfortunately, many doctors overlook. Cause number 1. Peripheral artery disease, PAD, the silent circulation killer. Peripheral artery disease is the most common cause of chronic cold feet in seniors, yet it often goes undiagnosed for years. PAD occurs when fatty deposits, plaque, build up in the arteries that supply blood to your legs and feet, narrowing the vessels and restricting blood flow. Why it's so dangerous? PAD doesn't just affect your feet. It's a systemic disease. If you have plaque buildup in your leg arteries, you likely have it in your heart arteries, coronary artery disease, and brain arteries, carotid artery disease, putting you at extremely high risk for heart attack and stroke. Warning signs beyond cold feet: pain, cramping, or heaviness in your legs when walking, claudication, that improves with rest, numbness, or weakness in your legs shiny, discolored skin on your legs or feet, slow-growing toenails, or hair loss on your legs, wounds, or sores on your feet that won't heal. Research published in Circulation found that people with PAD are 4 to 5 times more likely to have a heart attack or stroke compared to those without PAD. Yet only about 25% of people with PAD receive proper treatment because symptoms are often dismissed. A 72-year-old grandmother in Texas ignored her cold feet and leg pain for 3 years, assuming it was arthritis. When she finally saw a vascular specialist, tests revealed 90% blockage in her femoral artery. She underwent emergency surgery to restore blood flow. Her doctor told her bluntly, if you'd waited another 6 months, you would have lost your leg. What you need to do, if you have cold feet plus any of the warning signs above, ask your doctor for an ankle brachial index, ABI, test. It's simple, painless, and can detect PAD in minutes. Cause number 2, diabetes. The slow destroyer of blood vessels and nerves. If you have diabetes or prediabetes, your cold feet could be signaling 2 serious complications: diabetic neuropathy, nerve damage, and diabetic vascular disease, blood vessel damage. High blood sugar levels over time damage the tiny blood vessels that supply nerves, particularly in your feet. This causes diabetic neuropathy, a condition where you lose sensation, experience burning or tingling, and paradoxically, your feet may feel cold even when they're actually warm to the touch. Why this is terrifying: if you can't feel your feet properly, you won't notice cuts, blisters, or infections until they become severe. According to the American Diabetes Association, diabetes is the leading cause of non-traumatic lower limb amputations in the United States, with approximately 130,000 amputations performed each year. Warning signs of diabetic complications: cold feet accompanied by numbness, tingling, or burning sensations. Loss of ability to feel temperature changes in your feet, increased sensitivity to touch or pain in your feet, changes in skin color or texture on your feet, frequent infections, or slow healing wounds. A 69-year-old man with type 2 diabetes came to our clinic with cold, numb feet. He'd stepped on a nail 3 weeks earlier, but hadn't noticed because he couldn't feel pain. By the time he came in, the wound was severely infected. We saved his foot, but it required aggressive antibiotic treatment and wound care. What you need to do, if you're diabetic, check your feet every single day for cuts, blisters, or changes in color or temperature. Keep your blood sugar tightly controlled. And see a podiatrist or vascular specialist at least once a year for a comprehensive foot exam. Cause number 3, Raynaud's disease. When blood vessels overreact to cold, Raynaud's disease is a condition where small arteries in your fingers and toes constrict excessively in response to cold or stress, dramatically reducing blood flow. Your toes may turn white, then blue, then red as blood flow returns. This isn't just uncomfortable, it's a sign of vascular dysfunction. While Raynaud's is more common in younger women, it can develop or worsen in seniors, especially those with autoimmune conditions like lupus or rheumatoid arthritis. Warning signs: toes or fingers that turn white or blue in cold environments, numbness or prickling sensation when exposed to cold, throbbing or tingling as blood flow returns, and toes turn red, symptoms triggered by stress or emotional upset. What you need to do: keep your feet warm and dry. Avoid sudden temperature changes. If episodes are frequent or severe, medications can help dilate blood vessels and improve circulation. Cause number 4, hypothyroidism. The metabolism slowdown that chills your entire body. Your thyroid gland controls your metabolism, how fast your body burns energy and generates heat. When your thyroid is underactive, hypothyroidism, your metabolism slows down, your body produces less heat, and your circulation becomes sluggish. Cold feet and hands are classic symptoms. Studies show that hypothyroidism affects approximately 10 to 15% of women over 60 and 5% of men over 60, yet it often goes undiagnosed because symptoms are vague and develop gradually. Other warning signs of hypothyroidism: persistent fatigue and weakness, unexplained weight gain, dry skin and brittle nails, thinning hair, depression, or brain fog, sensitivity to cold throughout your body. A 74-year-old woman came to me complaining of cold feet, fatigue, and weight gain she couldn't explain. A simple blood test revealed severe hypothyroidism. Once we started thyroid hormone replacement, her energy returned, she lost the extra weight, and her feet warmed up for the first time in years. What you need to do: ask your doctor for a thyroid function test, TSH, T3 and T4 levels. Hypothyroidism is easily treated with daily medication. Cause number 5, smoking. The circulation poison you can control. If you smoke or have smoked in the past, you've likely damaged your blood vessels significantly. Nicotine constricts blood vessels, reduces oxygen in your blood, and accelerates atherosclerosis, plaque buildup. According to the CDC, smokers are 3 to 4 times more likely to develop PAD than non-smokers. Even if you quit years ago, the damage may persist. But the good news is that quitting now, no matter your age, immediately begins to improve circulation. What you need to do: if you still smoke, quitting is the single most important thing you can do for your circulation and overall health. Talk to your doctor about smoking cessation programs, nicotine replacement therapy, or medications like varenicline that can help. Cause number 6, sedentary lifestyle. Movement is medicine for circulation. Sitting for long periods slows blood flow, weakens blood vessel walls, and allows blood to pool in your legs and feet. This is especially problematic for seniors who spend most of their day sitting due to mobility issues, chronic pain, or simply habit. Research published in the American Journal of Epidemiology found that prolonged sitting is associated with increased risk of cardiovascular disease, diabetes, and even premature death, independent of physical activity levels. In other words, even if you exercise for 30 minutes a day, sitting for the rest of the day still harms your circulation. What you need to do: move regularly throughout the day. Even small movements, flexing your ankles, wiggling your toes, standing up every hour, can significantly improve circulation. We'll cover specific exercises later in this guide. Cause number 7, medications that restrict blood flow. Certain medications commonly prescribed to seniors can constrict blood vessels or slow circulation as a side effect. Beta blockers, used for high blood pressure and heart conditions. Certain migraine medications, decongestants containing pseudoephedrine, some chemotherapy drugs. If you started experiencing cold feet after beginning a new medication, talk to your doctor. There may be alternative medications that don't affect circulation. These 7 causes represent the most common culprits behind cold feet in seniors. But recognizing the cause is only half the battle. The next critical question is: how do you know if your cold feet are just a minor annoyance or a serious medical emergency? Let's talk about the warning signs you should never ignore. The warning signs you should never ignore. When cold feet become a medical emergency, not all cold feet are created equal. Some are simply uncomfortable. Others are screaming red flags that demand immediate medical attention. Here's how to tell the difference. Seek emergency medical care immediately if you experience 1. Sudden, severe coldness in one foot or leg, especially accompanied by pain. This could indicate an acute arterial blockage, embolism, or thrombosis, where a blood clot suddenly blocks an artery. Without immediate treatment, tissue death, gangrene, can occur within hours. 2. Cold feet with chest pain, shortness of breath, or arm pain. These are signs of a heart attack. Cold extremities during a cardiac event indicate your body is shunting blood away from your limbs to preserve your vital organs. 3. Cold feet with sudden confusion, slurred speech, or weakness on one side of your body. These are stroke symptoms. Cold extremities combined with neurological changes require immediate emergency care. 4. Cold, pale, or blue-tinged skin on your feet that doesn't return to normal color when pressed. This indicates severe lack of blood flow and tissue oxygen deprivation. Without prompt treatment, tissue damage becomes irreversible. 5. Open sores, wounds, or ulcers on your feet that won't heal. Poor circulation prevents wounds from healing properly, leading to infection, gangrene, and potential amputation. Schedule an urgent doctor's appointment within days if you notice cold feet accompanied by leg pain that occurs during walking and improves with rest. Persistent numbness or tingling in your feet, changes in skin color, texture, or temperature in your feet, thickened toenails, hair loss on legs, or shiny skin. New or worsening symptoms in someone with diabetes, heart disease, or vascular disease. One of my patients, a 70-year-old retired teacher, ignored worsening cold feet and leg pain for months. When he finally came in, his pain was so severe he could barely walk from his car to my office. Tests revealed critical blockages requiring emergency bypass surgery. He told me later, "I wish I'd come in when it first started. I could have avoided surgery and months of recovery." Don't wait. Don't minimize. Don't assume it's just aging. When your body sends warning signals, listen. 7 science-backed solutions to improve circulation and warm your feet naturally. Now for the good news. There are proven, practical strategies you can implement today to improve circulation and warm your feet. These aren't gimmicks or old wives' tales. They're evidence-based interventions recommended by vascular specialists. Solution number 1, targeted foot and ankle exercises to pump blood flow. Your calf muscles act as a second heart, pumping blood back up from your feet to your heart. When you move your feet and ankles, you activate this muscle pump, dramatically improving circulation. Exercises to do daily: ankle pumps. Sit or lie down. Point your toes forward, then flex them back toward your shin. Repeat 20 to 30 times, several times throughout the day. Ankle circles. Rotate your ankles clockwise 10 times, then counterclockwise 10 times. This mobilizes blood in all directions. Toe wiggles. Spread your toes apart, then squeeze them together. Repeat 20 times. This activates tiny muscles and capillaries in your feet. Heel raises. Stand holding onto a chair for balance. Rise up on your toes, hold for 2 seconds, then lower. Repeat 10 to 15 times. This powerfully activates your calf pump. A 68-year-old woman with diabetes and cold feet started doing these exercises 3 times daily. Within 2 weeks, she noticed her feet felt warmer, and within a month, her doctor noted improved pulses in her feet during examination. The science, research published in the Journal of Vascular Surgery, showed that simple ankle exercises performed regularly increased blood flow to the feet by up to 30% in patients with peripheral artery disease. Solution number 2, strategic temperature management. Yes, socks matter. This sounds obvious, but most people do it wrong. Here's the science-backed approach. Wear breathable, moisture-wicking socks, wool, or technical fabrics to keep feet dry. Moisture on skin accelerates heat loss. Use compression socks, if approved by your doctor, to improve venous return and prevent blood pooling. Warm your core body temperature with layers on your torso. When your core is warm, your body allows more blood flow to extremities. Pre-warm your bed with a heating pad or electric blanket, then remove it before getting in. Never sleep with heating devices directly on your feet. You risk burns, especially if you have neuropathy. Don't wear tight socks or restrictive footwear that constrict blood vessels. Use direct heat sources like hot water bottles on numb feet. You can cause severe burns without realizing it. Keep your bedroom too hot. Temperatures above 70 degrees Fahrenheit can actually disrupt sleep. Solution number 3, optimize your diet for vascular health. What you eat directly affects your blood vessel health. Certain foods improve circulation naturally. Foods that boost circulation: omega-3 fatty acids, fatty fish, walnuts, flaxseed reduce inflammation and improve blood vessel flexibility. Nitrate-rich vegetables, beets, Leafy greens convert to nitric oxide, which dilates blood vessels. Antioxidant-rich foods, berries, dark chocolate, green tea protect blood vessels from damage. Cayenne pepper and ginger contain compounds that stimulate blood flow. Garlic has natural blood-thinning properties. Foods to limit: high-sodium foods that promote fluid retention and constrict blood vessels, saturated fats and trans fats that contribute to plaque buildup, excess sugar that damages blood vessel linings. Solution number 4. Stay hydrated. Dehydration thickens your blood. When you're dehydrated, your blood becomes more viscous, thicker, making it harder for your heart to pump it through narrow vessels to your feet. Seniors are particularly prone to dehydration because thirst sensation decreases with age. The goal: drink at least 6 to 8 glasses of water daily, unless your doctor has restricted your fluid intake for heart or kidney reasons. Solution number 5. Manage underlying conditions aggressively. If you have diabetes, high blood pressure, high cholesterol, or other conditions affecting your circulation, controlling them is non-negotiable. Keep blood sugar levels as close to normal as possible. Maintain blood pressure below 130/80 mmHg. Keep LDL cholesterol under 100 milligrams per deciliter, or lower if you have heart disease. Take prescribed medications consistently. Solution number 6. Consider supplements. With doctor approval, certain supplements may improve circulation. Omega-3 fish oil, 1,000 to 2,000 milligrams daily. Magnesium, 300 to 400 milligrams daily. Helps relax blood vessels. Vitamin D, if deficient, affects vascular function. Ginkgo biloba, some evidence for improved peripheral circulation, but check for drug interactions. Critical. Always consult your doctor before starting supplements, especially if you take blood thinners. Solution number 7. Try contrast hydrotherapy. Alternating between warm and cool water causes blood vessels to dilate and constrict, essentially giving them a workout and improving their responsiveness. How to do it safely: soak feet in comfortably warm, not hot, water for 3 to 4 minutes. Switch to cool, not cold, water for 30 to 60 seconds. Repeat 3 to 4 cycles, always ending with warm. Dry feet thoroughly and put on warm socks. Warning: don't use this method if you have neuropathy, open wounds, or severe PAD without doctor approval. When home remedies aren't enough, medical treatments that restore blood flow sometimes, lifestyle changes, and home remedies aren't sufficient. If you have severe PAD or other serious circulation problems, medical intervention may be necessary. Medications: antiplatelet drugs, aspirin, clopidogrel. To prevent blood clots, cholesterol-lowering statins. To stabilize plaque, cilostazol. To improve blood flow and reduce claudication, blood pressure medications. To reduce strain on arteries, procedures: angioplasty and stenting. A catheter opens blocked arteries and places a stent to keep them open. Atherectomy, surgical removal of plaque from arteries. Bypass surgery, creating a new route around blocked arteries using grafts. These procedures have transformed outcomes for people with severe PAD. A 73-year-old man who could barely walk 50 feet without excruciating leg pain underwent angioplasty. 3 months later, he was walking 2 miles daily and his once icy feet were warm for the first time in 5 years. Our cold feet are telling you something. Listen: cold feet in seniors are not a trivial complaint. They're not something you should just deal with or get used to. They're your body's early warning system, alerting you to circulation problems that could lead to serious, even life-threatening complications if ignored. The key takeaways: white heavy check mark cold feet often signal poor circulation, which can indicate underlying heart disease, PAD, diabetes complications, or other serious conditions. White heavy check mark early detection and intervention can prevent heart attacks, strokes, amputations, and other catastrophic outcomes. White heavy check mark simple lifestyle changes, exercise, proper nutrition, temperature management can significantly improve circulation. White heavy check mark medical treatments are available when conservative measures aren't enough. White heavy check mark: never ignore warning. Signs like sudden coldness in one limb, non-healing wounds, or severe pain in your feet are trying to tell you something. Are you listening? If you're experiencing persistent cold feet, don't wait another day. Schedule an appointment with your doctor and specifically ask for a vascular evaluation. Early detection saves limbs and lives. Now I want to hear from you. Do you struggle with cold feet? What have you tried? Has anything worked? Share your experience in the comments below. We read and reply to every single comment because your story could help someone else recognize the warning signs and take action. If you found this information valuable, please like this video and share it with every senior you know. Cold feet are common, but they don't have to be ignored. Together, we can raise awareness and save lives one warm foot at a time. Stay informed, stay proactive, and remember, your circulation is your lifeline. Protect it.